probably know by now, the Senate has voted 60-40 really on Republican and Democrat divisions here have to essentially allow this health care bill to be voted on, although there'll have to be some reconciliation with the House of Representatives bill. And I've read where the Senate doesn't want any tinkering by the House of Representatives. I suspect there won't be a lot of tinkering because the Democrats want to get this health care bill passed. This health care bill will be a travesty for the United States. It will not deliver the type of health care that people claim for it. There are always cracks in the system with health care, and you can always bring up sad stories about people who have not gotten health care, or the health care they have gotten hasn't been very good. But overall, this health care system is in pretty good shape. Do there need to be changes? Yes. There needs to be changes in the regulation of health care by government. There needs to be more competition. Again, this is a government issue. The government puts a great deal of restrictions on health care companies, on insurance companies, as to what they can do and what they can offer. There are numerous mandates on insurance companies. This has to be covered, even though it isn't truly a medical condition. You can go on with these types of things. So there's a lot that could be done to health care that wouldn't literally tax the American people. It would make it easier for people to get. It would be much more affordable. I also believe that part of the problem we have is, in fact, health insurance. People don't pay much attention to a health care bill if they know if there's a third party, someone else paying for it. I mean, this is just human nature. Years ago, when I was in college at Western Michigan University, there was a time when there was a loophole in the law regarding food stamps. And I went to visit a friend, and he had all this food. His girlfriend was there, and he had all this food on his table. And I was wondering, I knew he didn't work. We were in all the same classes, and I had 2 small jobs when I was in college. I was on an athletic scholarship as well, so I really didn't have time to work outside very much. So the jobs that I did have were part of the one with the school, and also one outside. I worked on the weekends. But he had all this food. And I asked him, how was he able to do this? And he kind of laughed, and he said, I'm on food stamps. I said, well, how'd you get on food stamps? He said, just go down to the food stamp office. You take how much, what your income is, how much your expenses are. You bring your rent check, utilities checks, and so forth, and there's basically a formula, and they give you food stamps. And sure enough, that's what he did. Now, this law was eventually changed. If you were a dependent on your parents' income tax form, then you had to use your parents' income in order to justify whether or not you should get food stamps. But what he would tell me when he went to the grocery store, he was just buying everything in sight. Now, there are some things you can't buy. You can't buy cigarettes. You can't buy beer. There are some things that are restricted on there. But he bought the best cuts of meat, and he bought really more than he would have purchased if he would have had to pay for it out of his own pocket. And so when you have a third party paying in all this, you don't care about price. The only people who really care about price are the people who are actually paying for the premiums of the health insurance. This is a company like our company here at American Vision. We're constantly going over the price of health care policies because it comes out of the money that comes in here. If someone who's self-employed and has to buy their own policy, they're paying very close attention to price. When there's a third-party payer, you don't pay attention to price. When someone else is paying for it, what do you care about it? And so insurance itself is a problem. And there are many, many ways to fix the health care problem here in the United States, and it isn't by giving more and more power to the state. So this brings me to 2 other points. We have been involved in helping some organizations defeat this health care bill, not directly through American Vision. There's a for-profit company that I'm involved in, and Brandon Valerani is involved in. And some emails have been sent out, and I got a very terse response by somebody on this email list. The fact that he's on this email list means this was something that he got on. We didn't just indiscriminately just put somebody on an email list. Somebody had to actually go on this email list. And so this was to try to stop this very unconstitutional, burdensome health care provision that was going to go into law. And basically he said, F your mother. That was his response. I've later found out that he's an attorney, and we've had a couple of emails go back and forth. And I'm shocked that this attorney is so ignorant, until I realized that he is a personal injury attorney. He talks about he and some of his other partners, while we consider ourselves experts in personal injury, medical malpractice, and civil rights law, we have accumulated expertise in other areas of the law. And so this guy, he despises the healthcare industry, and he uses his legal abilities to gouge the insurance companies and gouge doctors. And again, I know that there are very legitimate reasons for going after the healthcare industry if in fact there is a real moral wrong here, and medical malpractice is certainly part of all of this. But medical malpractice insurance have driven many doctors out of the business, have increased their costs considerably. There have to be some caps on these things, especially when they go to juries, which is something that this person is involved in would do. He says, as co-counsel in 2 important personal injury cases, one of his partners and himself achieved $650,000 and $1.8 million decisions, respectively. Well, somebody's paying for that. The doctor's paying for it. His insurance premiums go up. And so this guy understands that you're not going to really see any change in terms of tort reform. The majority of congressmen and senators are lawyers. They are going to defend their own positions. This health care bill is not going to protect doctors any more than it protects them now. You're going to see all sorts of litigation taking place as a result of all of this. Another point in his letter, in subsequent emails from me, he castigates, as I would have, Ben Nelson and Joe Lieberman. He writes, what is absolutely immoral is the Republicans standing in the way of the functioning of our democratic system. Well, this is part of the democratic system, and that is standing in the way of bad legislation. That's why we are a two-party system. Threatening filibuster when they don't have the votes to carry the day. The filibuster is part of our constitutional system. Seeking out whores like Ben Nelson and Joe Lieberman to sell their souls to the highest bidder. This lawyer also says that he's worked for political candidates, especially Democrats. Well, Ben Nelson and Joe Lieberman Lieberman used to be a Democrat, now he's an independent, he's still a Democrat, and Ben Nelson is a Democrat. But all of these guys have sold out. That's what this legislation is all about. And Republicans are just as bad as these guys. They buy votes. This money that they're getting is coming from other states. Ben Nelson from Nebraska, where do you think that money is coming from? Joe Lieberman, he gets money for his state. Where does he think that money is coming from? Mary Landrieu from New Orleans in Louisiana, where's that coming from? It's coming from other states. This is what these guys do. This particular health care bill is going to be paid for by us, whether we benefit personally from it or not. And so this lawyer who sent this very derogatory comment to us here at American Vision is part of the problem. He wants the state to take over health care. He believes that this is a good system. It isn't a good system. It will bankrupt us just like Social Security has bankrupted us. 1935, Social Security, 12.6% on a total of $3,000, $60 per year. Now we are in the neighborhood of paying over 12% on over $105,000 a year. Why does he think this health care program is going to be any different?